can I manage to maintain mental health and balance without chemical intervention? We shall see. This is my aim at the moment. Okay, so you may or may not know that part of the reason I started this YouTube channel was a realisation that I wasn't very in touch with myself. And that was having a very detrimental effect on my mental health. Now, I have a history of depression, anxiety, and a few other things. And while I have benefited from chemical intervention, it doesn't last. And I am trying to navigate, maintain, and live with those mental health issues without chemical intervention. I don't want to go back there because I don't like what it does to me. So, this could be quite controversial because I know that medication is a valuable tool when people are in crisis and need a break and need some relief from their mental torture. I am not saying it is not useful, but I don't like what it does to me. There have been too many occasions when I get to a point where I'm too afraid to come off. I get too used to feeling how they make me feel, and I don't want to go back to what sent me there in the first place. There was an interesting interview that it was John Whitlock, and I can't remember the doctor that she was interviewing, but he was very interesting, and he was saying that chemical medication for mental health is not a long-term thing. It's like a brace for your ankle or a cast for a broken bone. They are not meant to be used continuously. But too often, you're offered this reprieve in the form of a pill that you take once a day, twice a day. And it seems so easy to think, perhaps it'll just give me a little bit of relief. But there's no end point. It's not always prescribed in conjunction with any kind of therapy or alternate methods of dealing with the mental health problem. And although I was offered it, I have struggled to find a decent therapist. It's a problem. I think it's a me thing. A me problem, not a them problem. I just haven't found anyone that clicks and lets me talk how I want to. But it's very rarely offered in conjunction, and you have to ask or you have to chase after it. But when you're in that kind of crisis situation, you're really not in a position to objectively look at things and say, actually, I would rather try this method, because you're already in crisis, you're already not thinking straightly. And that's not a word. You're not thinking. What's the word I'm looking for? I've completely forgotten. But you're not all there. You are stuck in your own mire. Too much to see out of it. And this is where I have a problem. I know people who have been nonchalantly prescribed antidepressants, anti-anxiety meds, things like that. Sometimes they're one and the same thing. And at least one of them is still on them more than a decade later because they're too frightened to go back to the dark place that they were in when they got them. And I've been there. And it took someone else discovering that, or highlighting the negativity, to realise that I had got to the point of long-term use. I wasn't actually getting any benefits. I was just seeing the downsides. So, what am I doing to try and navigate this really weird situation where I don't want to take the help offered? It's a tough one. Now, one thing I have noticed, that when I am in a bad place, it is because I have been bottling things up. I have not been allowed to create. I have had so many other things on my plate that I've not done it. Quite frequently, I've also been working more hours than I was supposed to, just because. But I have noticed some repeating patterns. So if expressing myself and bottling things up are two sides of that coin, I need to express. I need to get things out. I need to create. I need to write. I need to make, etc. And I need to share. If I'm struggling, if I'm not coping well with my situation, I need to share that. It could be with my husband, it could be with my sister, it could be my mum. But I need to share it. I need to acknowledge it. Rather than pushing it down and squashing it, I need to get it out and tell anybody that I'm struggling. It doesn't even need to be particularly insightful. They don't need to really know anything about me. But I have to get it out. Catching dark thoughts. Now, I have been through active self-shuffling off the mortal coil. Obviously, I didn't succeed. And I'm quite pleased about that. But I do go through periods of passive self-shuffling. Those feelings of, wouldn't it be better if I didn't wake up? Or I didn't exist? Or any of those other really dark thoughts. I've learned to catch them. Or I am learning to catch them. Because then I have to work through what's putting me in that position. Is it that it's everything around me that's leading me down that path? Or is it something within me? And I have also started recognising triggers and behaviours and activities that signal that something's not quite right. For example, if I do lose my creative spark, not things like writer's block or not knowing what to draw or things like that, because if I can switch between creative tasks, then it's not just I've lost all creativity, I don't fancy doing that. Binging certain musicians. If I start binging Nick Cave and Tori Amos, I know I'm going down a dark path. Now, there's nothing wrong with listening to them occasionally, but when I start making them part of my daily playlist and they're always on, I know there's something wrong. Now, when it comes to triggers, what things specifically get into my head and start unpleasant trains of thought and cause me anxiety attacks and panic, and what causes me to be distant with people? I'm still working on that. Yes, I can identify some of them, and they're not rational. I'm not even for 1 minute thinking they are. Most of the time, they are completely irrational. If they were rational, it wouldn't be a problem, because it's not mental health. It's just that life at that particular moment sucks. So, yes, it sounds like an awful lot of like mental load to keep watching myself. But from my perspective, it's better than going back. Because the last time I was on anti-anxiety and antidepressant medication, I was on it for 3 years. Yeah, it's not meant to go on for that long. It's meant to be a reprieve and a way to actually get yourself out of the crisis so that you can find your own way back to your life. But you forget that. You spend so much time titrating up in the medication to see what works. And they keep going up and up and up until you hit some kind of equilibrium. But then there doesn't seem to be an end point. There doesn't seem to be a point where it's like, right, try and maintain this equilibrium for so long, and then we'll try and take you back down. There isn't that kind of short-term approach to medicating mental health, especially when it's things like a GP, like a general practitioner, or primary care physician if you're in the US. They are not experts, and no one can expect them to be. But they still have the ability to prescribe. But because they're not experts, they don't have that kind of timeline in mind. They just want to get you out of your immediate crisis, which is fine. But when you've been on them for long enough, maybe it's 6 months, maybe it's a year, you get to a point where you don't actually feel any better for the medication that you're taking. And you know that big long list of possible side effects, like losing your sex drive and being irritable and possibly having nausea and not sleeping properly. You get to a point where you're not feeling any better. You don't feel like you've made any progress. But all of those side effects, or some of those side effects, just keep building. So all you're getting is the negativity. But you're still so frightened of going back to the dark place that you don't want to give up this kind of half existence. And for me, by the time I actually made this decision to stop and say, no, I need to do this now because I'm not getting any better and I haven't been for a while. So I decided to start reducing my intake. And I did it on my own. I didn't do it straight away because I'd already experienced that. So I did it properly. I came off slowly and I didn't actually feel any worse. But I actually felt better for coming off them because I wasn't getting all the negative side effects. And it's not a short list. So I was feeling emotionally numb. And when you're a creative type, emotionally numb is not good. Because creativity comes from emotion. And it inspires emotion. And when you don't have any, it's kind of flat and dull. Feeling socially disconnected and apathetic, I had no drive, no desire to do anything. And other people's issues didn't mean anything to me. It was just, bleh. And then being irritable, impatient and intolerant. Now, that's fine. If you are generally an irritable, impatient and intolerant person, bonus. You just get to enhance your natural powers. But when you have important people in your life, like a partner or a small child, it's not a good thing to be because you find yourself tanking your own relationship just because you're not present. And then there's libido. What's that again? And at the same time, I wasn't sleeping properly because I was avoiding going to bed at night because I didn't want to lay in the bed next to my husband because I had completely given up on intimacy. And cognitively, I felt a little bit guilty about that. And then because I wasn't sleeping and actively not sleeping, I would need to sleep at other times. I would need to sleep more. And completely screwing up any kind of idea of a rhythm. Sleep cycles and all that. So, I forgot one. Creatively stunted. And I don't mean being creatively stunted and caring about it and being worried about it. I'm talking about being creatively stunted and not having any kind of desire to fix it. Just letting things go. So that was a dark place. I was not even me. I was someone else that I don't like and don't ever want to go back to. So this is why I'm trying to navigate my slightly unstable mind without drugging myself into a stupor. And I'm trying to stay a few steps ahead of myself. Because if I let myself slip, it takes a lot more to pull myself back. And I might actually need chemical help. And I don't want that. I don't want to be reliant on something that takes me away from myself. Because that's what it does. It takes you away from yourself. And while taking you away from your pain and separating it is a good idea when you're deep in the mire, it's not a good idea to stay reliant. I am not going back into that dark place because that's not me. And if I'm going to find out who I am, I need to stay connected to me. Yes, I can still cry at adverts where there are starving orphans and droughts and things like that. I will still weep buckets at First Blood, the Rambo film. Yes, not many people cry at those. I absolutely sobbed my heart out at the beginning of Rocky Balboa. I will blub at anything with any kind of emotional charge to it. And I like that. Because it means I am still connected to my emotions. And I don't think that we are ourselves if we are disconnected from them. Now, I am not saying chemical and medical intervention in mental health is not a good thing. It is. But it should have a timeline. It should have a dedicated treatment plan that goes with it. It shouldn't just be a take this one. See how you're doing. Take a bit more. Take a bit more. Oh, are you feeling better? I think so. I don't feel quite so terrified. I don't feel like I'm going to do something unpleasant. Oh, we'll keep you there for a while. There's no genuine or considered approach. And while it's very easy to go to a GP or what have you and get this immediate fix, or what feels like it might be an immediate fix, but unless you actually combine it with other things, even if it's just like following certain psychological exercises and things like that, if you can't find a therapist that works for you, etc., working in tandem with different treatment options and methodologies is a must. And this is my approach for me, because I can't find a therapist that I like and want to talk to. That is essential. You have to want to talk to them. Spending money on an hour of therapy is, when you don't want to talk to somebody, is not a good plan. You just feel resentful. So I'm going forward with this. I am not suggesting it will work for everyone. I am on my own path. It might work for others, it may not. But I'm plugging away because I want my mind intact and inside my head, even though it's a very strange place. So, ta-ta for now, and I have rambled enough.